Hello, everyone. How are you today? I hope that you are doing well and today finds you in perfect peace in every area of your life. So today is June 16th. That makes it the 16th day of Uterine Cancer Awareness Month. And as a uterine health advocate, I am committed to posting every day during the month of June information regarding uterine health and uterine cancer. Sometimes it could be just a wide range of topics that I present to you, but it will all align with uterine health and uterine cancer. I also want to take the time, and I usually do this at the top of the video, is to thank you. Thank you so much for viewing the video. Thank you so much for sharing, commenting, liking, and most definitely, thank you for subscribing to this channel. I really appreciate all of the engagement that you provide with this channel. So, I always start off as well, letting you know that my disclaimer is always written in the description, but I like to say it verbally. I am not a medical doctor. I'm a uterine health advocate, just so you'll know. So yesterday, I was, doing a little bit of research to figure out what today's topic was going to be, and I don't know what I put in my internet search, but I put in something, and then I ran across the word sarcoma, and I said, "Sarcoma? Well, what is sarcoma?" And then I said, once I started doing a little more information about it, I said, "This is definitely the topic for today." So I had never heard of sarcoma, so I thought, and it does involve the uterine, so I thought I would go ahead and talk about it today. So today we're going to talk about uterine sarcoma, what it is, right? So uterine sarcoma is a rare, aggressive type of cancer that develops in the muscles or supporting connective tissues of the uterus. It differs from the, endometrial cancer, where the cancer starts in the inner lining. And uterine sarcoma accounts for 2 to 4% of uterine cancers. So, uterine sarcoma is a rare, aggressive type of cancer that develops in the muscles or connective tissues of the uterus. So, I still have my, hope you can hear me, it was way over there. I still have my handy dandy chart here, and I hope that I get it right. So I do believe it means like this is in the muscles of the uterus. I do believe that's what it means, because this part right here is the lining, and that's like when people get endometrial cancer, it'll start right here in the lining. That is saying that sarcoma, hope I'm getting this right, is in the muscles. This is a diagram I have. I need to get a more one that says where the muscles are, but I do believe that's where it will start, your sarcoma. So because uterine sarcoma form deeper in the uterus, uterine sarcoma is often found after hysterectomy is performed. For another reason, you might be having a hysterectomy, and then sarcoma is found. And sometimes they found during surgery, as people are when you have a myomectomy, when you're having your fibroids removed. So, and then I found out that I found 4 different types of uterine sarcoma. So when you're diagnosed with it, you may have a different type of sarcoma depending on the exact cells where the cancer originated. So, of course, I had to have my pronunciation ready. So the first type of sarcoma is leiomyosarcoma, and this is the most common type of uterine sarcoma, and it starts in the smooth muscle layer of the uterus. So this is the most common. And then there's endometrial stromal sarcoma. It forms in the connective tissue of the uterine lining. Then there's the undifferentiated uterine sarcoma, and this is aggressive and fast-growing tumor that does not fall in any typical category. And then there's uterine adosarcoma. I said that kind of weird, really. I'm going to repeat that because I like to get everything right. It's uterine adosarcoma. It's a rare and usually slower growing mixture of both the glands and supporting stroma cells. So these are the 4 different types of, uterine sarcoma that you can get, which is the cancer of the uterine muscles. So some of the symptoms that you may have for this type of cancer They said they don't know where this, the exact cause is known from it, but some of the symptoms are, they said, unspecified and can mimic non-cancerous conditions like a fibroid. So some of the symptoms, you could have abnormal bleeding, especially after menopause. You can have bleeding that is not part of a menstrual period. You can have pelvic pain or a feeling of fullness in the abdomen. You can notice a mass or a lump in the vagina or pelvic region, and you have frequent urination or constipation. Some of your risk factors, again, it's not known where sarcoma comes from, but there are risk factors that can increase you developing uterine sarcoma. The first one is past radiation therapy. If you've had any previous radiation treatment to the pelvis area, that's one cause. Past and ongoing medications like taxophimine that people take for breast cancer. It could be something that's genetic, that you inherit a gene. And it can be based off of demographics, right? And they said the risk is elevated in women who have never been pregnant, women between the ages of 50 and 70, and it is higher among African American women. They said Black women, the rate is twice as high as white women and Asian women for uterine sarcoma. We also have a diagnosis and a treatment options as well. So because sarcoma can be difficult to distinguish from fibroids, when they do your regular ultrasound, a definite diagnosis often confirmed via a biopsy or, historically it's been from surgical procedures like a hysterectomy or, like I said earlier, from a myomectomy. Because these tumors require specialized care, treatment management can come from a team of experts and maybe not just your one doctor if your diagnosis is. And some of the things they offer for treatment might be surgery, which is the primary approach and is often required to diagnose what type of uterine sarcoma you have, the stage you're in, and the treatment that they think is best to provide healing for your body. And then there could be additional therapies that depending on the stage of the cancer, the grade, you can have radiation, chemo, or hormone replacement therapy. So there's different options for you to, have if you do have this type of cancer. And so I did provide you some articles for reference that I did find. The first one is and I will put these in the description, but I just want to let you know they're there. The first one is from the American Cancer Society. It was written in September 2022. And it says, the title is, "What is Uterine Sarcoma?" The second one is from Penn Medicine, and it says Uterine Sarcoma. The next one is from the Cleveland Clinic, which was July 2025. Uterine Sarcoma is the title. Northwestern Medicine, "What is Uterine Cancer?" And I like this one because it did have, talks about uterine cancer, but it does have a good paragraph about sarcoma in there that I thought was pretty informative. And then the University of Florida Health, Uterine Sarcoma. So I chose these, as I'm doing my research, I do an overall research, of course, but then I go look for different articles and I skim them and I see, and sometimes I pull out information from them. And then I think if a person is, interested in this information, that at least I provide you with, articles of reference for you to get started. So I think it's very important. I was kind of, I'm going to be honest with you, kind of shocked when I found out about this, because I had never heard anything about uterine sarcoma, which is why it's so important. I keep saying this in every video, that it's so important that we know what's going on with our bodies as women. Well, if you're a man watching too, it's important we know what's going on with our bodies. It's important that we know different options that maybe the doctor didn't think about, or, didn't think we were a candidate for, or didn't think it was, possible for different things. But we're all different. Our bodies are different. You can see here, based on ethnicity, that, and race, that, African American women are twice as likely to have this over white and Asian women. So it's very good that when you go to your doctor, that you are equipped with information that I think that, provides you the opportunity to have a very healthy conversation that can lead to a healing plan for your life, and to also make them think too, because again, like I said, it might be oh, I didn't think to look at this. So now this has me in my mind thinking, so if this is difficult to find because sometimes they think it's, it's like a fibroid looking, then I'm wondering, are we just seeing fibroids, or are we seeing sarcoma? And I think that's a good question to ask, you know, uh, someone, especially if you're dealing with a lot of fibroids, but at least you did see the type of symptoms here too. So if you're having these kind of symptoms, especially the, like your pelvic pain and, urinating and constipation, it might be something more than just a benign fibroid. And it says that, unfortunately, I was reading that up to 50% of this case goes undiagnosed because, the way that the sarcoma sits and develops within our body. So it's important for us to know these things, and it's important for us to be aware. So that's it for me today. I hope that this information was helpful to you, to learn that there is, when it talks about uterine cancer, there is endometrial and there is sarcoma. So now we know that there are two types. Well, at least I'm learning that there are two types of cancers in the uterine. Guys, when I tell you yesterday, you know how I felt. It was just so much things that we go through with our bodies, and especially you think you're getting older and everything is done, like anything. And now you're finding out that this is something between 50 and 70. And if you've never had children, and if you've had some other kind of treatment, it could affect, you getting this. So when you pray and you pray over your body, you have to pray against everything in the name of Jesus. That's how I believe in praying. So anyway, so just thought I would share with you what is a uterine sarcoma. And I hope that you have a great day. I hope that if you have any of the symptoms that was listed, or any other symptoms that's in your body, that you take the time to make the appointment to go see your doctor. You make the time and the appointment to openly share in that time with the doctor what you're facing, what you're feeling, what your symptoms are. And so that, I believe, when you're honest with your doctor as well, that you can also develop a plan for more healing. But if you're not honest and you say, oh, well, it's just a slight pain, but it's not a slight pain, it's like major discomfort, tell them that. Don't let them think that you're a superhero when you go to these doctor's appointment. Let them know that you are feminine, you are a woman, and you are facing these things. Take the cape off and take care of you. Well, that's it I have for today. Don't mean to be preachy, but I just want us to be, thinking of ourselves more, and showing ourselves grace, and realize that sometimes we have to sit down before our body sits us down. So take the opportunity to go to the doctor and, develop a plan of healing for yourself. And if you don't have any of these conditions that I've been talking about so far this month, then take this opportunity to see, what steps can I do to have a more healthier lifestyle? Doesn't mean that things won't come to you, but it means you can be proactive instead of reactive, right? Again, I'm like a preacher now. I've been saying goodbye for 3 times now. So this is it for real though. So I hope that you have a great day. And until next time, take care of yourself.